This is Dr. Bryan Weinstein. I want to take this opportunity to talk about attention deficit disorder. Um, Clinically, it's referred to as ADHD, and that entails the three primary types of ADHD. Sometimes it's also referred to ADD, but ADHD is commonly how it's used, the term. It can manifest itself in three different ways: inattention, um, hyperactivity, or impulsive type. So those are the three separate types of ADHD. ADHD is a neurodevelopmental disorder, and it's defined primarily by impaired levels of attention, disorganization, or hyperactivity or profound impulsivity. The inattentive aspect of deficit disorder has to include usually at least six symptoms. These symptoms have to occur in more than one sphere of activity functionality. In other words, if somebody comes and says, "Hey, my child does poorly in school. He has ADD symptoms," unless he does poorly in at least another facet of his or her life, we wouldn't necessarily look at that. We look at maybe some other disorders like anxiety disorders, performance disorder, performance anxiety, things of that nature. So there has to be a manifestation of these symptoms that negatively impact academic, occupational activities, but also in other spheres like social, family, behavioral issues with other individuals. So generally, you can have multiple symptoms, and they would include, difficulty paying close attention to details, making careless mistakes, difficulty sustaining attention, keeping on task or play activities, being able to focus on, long lectures or conversations, lengthy reading material, things of that nature would be difficult for individuals with ADHD. People might experience the inability to be, when they don't listen to you. If you're talking to somebody who's struggling with ADHD, they do not seem like they're listening when spoken to directly. People with ADHD would have trouble following through on instructions, failing to finish schoolwork or occupational work, duties in the workplace. They would have difficulty with organizational skills, constantly procrastinating. People with ADHD avoid or dislikes, or highly reluctant to engage in tasks that require sustained mental effort. Um, they lose things quite frequently, misplace things, books, keys, wallets, tools, paperwork, glasses. Very frustrating. They're easily distracted and they're highly forgetful. Hyperactivity would include fidgety, squirming in one's seat, constantly the need to leave their seat in the workplace or in the classroom, very restless, kind of like there was always some motor going on inside them, very on the go. Many times people with ADHD do high risk behaviors, because they're always driven, sometimes, physically and certainly within their mind. They can talk excessively. They can blurt out answers before questions have been completed. They can interrupt others. They can be very intrusive. The impulsive aspect of attention deficit disorder can include being highly impatient, having a hard time waiting their turn. Again, blurting out answers, interrupting others, starting conversations at inappropriate times. So these are all the symptoms of attention deficit disorder. But what's really critical to understand is that without care and without treatment, these can go on and lead to depression, anxiety, substance abuse and dependence disorders, low self-esteem, low self-image, irritability and anger problems, pronounced frustration, and constant irritability, constant internal disorganization within their mind, and this leads to a heightened state of feeling, having poor self-esteem and having low self-image, and again, leading to these much more severe mental health disorders. What causes ADHD? Sometimes we don't know. We know that in pregnancy, women who smoke or drink alcohol, there's a higher propensity for having children with attention deficit disorder. You can have acquired attention deficit disorder due to concussion and traumatic brain injuries. But again, people who struggle with ADHD do require attention and do require care. And that care comes from pharmacological attention, medication management. We usually in psychiatry treat ADHD with two primary categories of medication: the methylphenidates and the amphetamines. You've many people have heard of medications like Ritalin or Adderall. These are great medications, and they truly bring down those inattentive centers, and they help to allow individuals to focus and concentrate better. Behaviorally, that's a huge component, and well-trained psychologists and behavioralists can help a person with organization, learning to cope through attention deficit symptomatology throughout their day, and work on, again, coping mechanisms, organizational mechanisms, ways to be less distracted, building quiet environments, knowing when things are a problem. These are all the components of attention deficit disorder, the treatment of attention deficit disorder, and understand that it's a real disorder. It's a neurodevelopmental disorder that is acquired either genetically or induced either through pregnancy, again, alcohol, smoking, things of that nature, and then again can be acquired either through traumatic brain injuries or things of that nature. Um, you know, Understanding that a significant part of the population, usually manifests attention deficit disorder in childhood. This usually goes on into adulthood, and most people do not grow out of ADHD, but they might have different symptomatology as they grow up and get older. But it many times manifests right into adulthood and can threaten a person in their workplace or in their home environment. So, you know, I think I presented the overall case for attention deficit disorder and how people manifest and the treatments. Thank you.